Hey everybody, Ryan Molli, and this is such a very cool guest this week. It's actually my neighbor, Dr. Kimberly Mascia. She's classically trained as an internal medicine doctor, but she now owns and operates SpaGo, which is a medical spa, and it's not just any medical spa. Without further ado, Dr. Kim Mascia.
Well, hello.
Welcome.
Great to be here.
Yeah, thank you for coming on. So,
And that's long and short how we ended up dating eventually.
That's a love story right there. The malaria marriage.
Yes. Yeah.
Right?
Yeah.
If that happens, great.
Fine.
Right? But how many houses, cars, yachts,
Right.
whatever.
Right.
And I like nice things.
Yeah.
I
yeah.
really-
But
I-
you and I both downsized
We
because
did.
there's beauty in simplicity too.
Yes. Like not having to go to the
Yeah.
lake house. I'm not saying that we won't have a second home someday.
Yeah. Yeah.
It's just not the right time in our life.
Yeah.
Right? Like
Yeah.
it's more important for me right now to be at my boys' games
Yep.
and to be present.
Yes.
Here.
Yes. Yes.
Right? Not a distraction somewhere else.
Right. Right.
So another
I'm
personal
dealing with
question
that.
for you.
Yeah.
Podcast, but an episode in my life where I was operating on a patient. I had never in my life prayed so hard during this operation.
Wow.
And everything, all's well that ends well, right? And
Yeah.
it was, I mean, I think it took 10 years off my life, like the
Yes.
amount of angst that I had during that case. It was the scariest moment in my life.
Yes.
So
Yeah.
you're talking about building like the regional.
The men's health aspect.
Yeah, mental health.
So there were so many things that I had because I did an allopathic pathway in medicine. I had preconceived notions about certain things. And there are so many things that we're learning functionally that are true. And I'm going to say it here today. There are things down to whatever heavy metals are in your diet, like zinc and selenium, that are very important. But men's health is very important. I was always concerned about testosterone replacement, something simple like that. And testosterone replacement builds bones. There is no evidence whatsoever that it would increase your risk of prostate cancer, which is one of my primary concerns, is weighing the benefits versus the risks.
Yeah.
And things like that.
And
So
people
I'm
make those
hoping,
assumptions, right?
Right. And so
What
there's a
about
lot of
testicular
functional
cancer?
things.
Anything there?
Nothing.
Nothing.
Absolutely nothing.
And
Dr. Hancock, who thank goodness is educated and knows the latest data on estrogen replacement in post-cancer patients. And that segues into how Erie is such a great place. You're not always going to get the greatest care out of town. Look to your Erie doctors, your Meadville doctors, people locally, because they've had the training they needed, but they care about your community more than someone out of town.
But,
maybe in Cleveland.
my philosophy is like, well, we're doing one podcast. Why shouldn't we start a second? So getting ready, little sneak peek, teaser, not telling you the name just yet, but we will be starting kind of like a truly medically oriented podcast for other physicians that are looking or really exploring that autonomy of private practice.
Excellent.
Because that pendulum has swung so far to one side, but
Oh, yeah.
just stay tuned. We'll give you some more
That's
on that.
fantastic.